Let's talk about back pain for both your cheerleader and for you as a cheer parent, because back pain can really be debilitating and can create havoc and will hold your cheerleader out from competing and from practice, from tumbling. And if you're a parent dealing with low back pain, it's also going to be a real pain for you too. So let's dive into this. Welcome to the Cheer Athlete Podcast, where we bring coaches, parents, and athletes expert tips and advice to help keep cheerleaders healthy, strong, and at the top of their game. Now let's go. Hi, if you don't know me, I'm Laura Turner, and I'm the Cheer PT, and I am on a mission to help cheerleaders stay active and healthy and stay on the mat. But I also want to help you reduce your back pain, reduce your hip pain so that you can drive to those practices, fly to the competitions, and travel and carry your luggage and be able to still live your life and be active in the process because you need to take care of yourself too. So I'm changing my focus a little bit. We're going to talk about both of you and how you can manage your symptoms in some of these upcoming episodes. I want to thank you for joining me. This is the start of my 4th year of doing this, which blows my mind. And I'm shifting gears a little bit because I want to make it more encompassing for the cheer triad, the parents, the coaches, and the athletes. And I've been out of physical therapy. I'm in physical therapy. I've been a physical therapist for over 30 years now. And I have been out of the cheer world. So my cheer lingo may be a little bit off for about 10. But I've done a lot of research on cheerleading injuries, and I'm very passionate about that. And I want every cheerleader to want to continue to cheer into college and beyond. So that's why I continue with the cheer athlete and the cheer PT. Let's dive in. So back pain. You can have all kinds of back pain. How do you know if it's something you need to urgently get looked at or something that is okay and you just have to do some exercises and start to feel better? Well, one, obviously a catastrophic injury that you can't move your legs. That's a no-brainer. Hopefully you all know, like, if there's somebody who comes down, falls, for whatever reason, there's a potential for a spinal cord injury. Emergency, call 911, they go out on a stretcher. Those are catastrophic. We're not talking that right now. We're going to talk more muscle strains. And with cheerleaders, it's very common to have what's called a spondylolisthesis or spondylosis, which can be a fracture in the pars, which is part of the spine. So if you think of your spine, if you look at my fingers, if you're watching on the video, I have, it's kind of like a Star Wars, like a shooting, I don't know, I picture Spider-Man shooting out the web. But my 2 fingers are on top of each other. These 2 fingers here, my pointer fingers, are the spinous processes. And then on either side are the facets and the transverse processes. And so on the side, we get a fracture in what's called a pars with a lot of hyperextension motions. So somebody that tends to be more hyperextended through the back, they stand with their booty out a little bit and they have more pressure through the lower back. You might get more compression in through there. This happens with gymnasts and cheerleaders frequently because they pivot right at that point. And if they don't have the mobility through their upper back and they don't have the strength through their shoulders or the mobility through their shoulders and the power through their legs, you're going to get that repeated stress in that lumbar spine. And that can potentially create a fracture, which in and of itself it's not fun, it's painful, but it's not necessarily going to create a spinal cord injury. It just will create some compression on the nerves. And that, if we have both sides fractured, the vertebrae then slides forward. The top one will slide forward on the bottom one and create more pressure there. And that creates pain in the back. It might create some leg weakness. But again, not catastrophic like spinal cord injury, but it's definitely something you want to get addressed and build core stability and really retrain, get better hip mobility so that you're not hitting that pivot point through the back. People go on, I've worked with many clients who have gone on to do jumping and tumbling, and I worked with one 14-year-old kid who was a pole vaulter. So you can imagine, like, it's the same handspring motion. And he just really had to train his core to be able to extend up and over, but not hyperextend and just pivot at that point. So certainly, if you've had an injury like this and you've had repetitive strain there and you have a lot of pain across the back, or maybe you're a former cheerleader yourself, you potentially may have had a spondylolisthesis. Again, correctable, but it does take some work. It does take time to get stronger. We'll touch on that in a little bit. Let's talk basic muscle strains. When you're a cheerleader, if you're a base, you are pushing up, you might be twisting, you're kind of side bent, you're coming up and under, and there's a lot of components of the muscles have to side bend, rotate, bend, extend, all of the stuff throughout any stunt transition. And the same thing goes when you're tumbling. And so if one muscle is overworking and overpowering and the other muscles are not, that creates a repetitive strain, and that can really be a nuisance. So we want to balance them, right? The mechanics may not change. I mean, ideally, we're going to find pairs in stunting that are going to be, you're going to be the right height. We're going to be able to get up underneath the stunt. We're going to have strong legs to be able to really move in power. And we create that timing so that it all comes together and it doesn't put the strain through our back as we do it. But odd things happen, right? We have mishaps. We have people coming down. It's a learning curve. And we develop habits. So our bodies kind of get tweaked into different positions. Same thing goes for flyers. If a flyer is pulling hard on their heel stretch and they're hiking their hip to get it up there, or this is where the spondies may come in. If they're really pulling a scorpion or up into a needle, you get that compression in through that lower lumbar spine. That potentially could create that spondylolisthesis that we just talked about. So you also could create, because even just in a scale, you are rotating and twisting and hiking the hip. And I've worked with people, again, who they just get that compression through there. So part of the solution is to work the motion on the other side to create balance, not up in the air, but on the ground. If they're shortened on one side and it's really tight on the one side, my advice to all of my clients, if it hurts to go to the right, try going to the left. Now, if you have pain on the right side and it's kind of in this area, the lower back, maybe to the side a little bit, and maybe extends into the hip and the butt, you'd think side bending away would help stretch that. The obliques one of the obliques the side bending away will stretch it, but maybe it doesn't want to stretch. It also rotates, so you might need to play with some rotation. If it hurts to go left, try going right. So sometimes feeding the pattern more and going more into that feels better, actually helps to reduce pain, and it creates a less strain on that, so it allows you to then lengthen and go long. There's not a right answer, and everybody's different. So if it hurts to go right, try going left, even if right is the direction that you want to improve and go towards. It will all depend, and I know this is kind of all over the place, but we have to start to feel what's in our body and see, okay, if I move this way, it doesn't feel good. So I'm going to try and move more the other way, and then try to go about our day and see what that feels like. As adults, same advice. If it hurts to go left, try going right. If it hurts to go right, try going left. And try to blend that and keep a balance of your muscles of coordinating that. Now, things that go along with lower back pain that might be a contributor, a lot of times hip flexors are tight, hamstrings are tight, hips, the lateral hips, the glutes are tight. But tightness doesn't always mean that something needs to get stretched or loosened. Sometimes tightness means it needs to get stronger. So if somebody, again, has that hyperextension in their lower back, their booty sticks out, they may have shortened hip flexors, but they might be weak, and we might need to actually strengthen them, so that helps to keep them, at a regular tension. And I do a technique called neurokinetic therapy, in which I muscle test these to find out what's overworked and overcompensating compared to what's underworked. And then we do a stretch for the one that's overworked, and we do stability work for the one that's underworked. It's not strength. Our cheerleaders are very strong. They have to lift people. They have to be strong and stand up in the air. They're strong, but they may not have that motor control and that stability that they need to keep your core muscles have to react quick like that. And they have to fire at just the right time. And if they're not firing at the right time, then things are going to be unstable. Not unstable to the point of, dramatic injury, but they're unstable the fact that they have to react better and they might create some pain. Same thing with the muscle that's overworking might be tight and might be just sending a lot of signals to your brain like, hey, I don't like this. Let's do something different. So finding ways to balance motion. If you're a cheerleader or you have been stretching, you're like, my back's tight. My PT told me to do my hamstring stretches and I am stretching them all the time. I'm stretching them and nothing's getting better and I still hurt. And maybe you don't need to stretch it. Maybe you actually need to strengthen your hamstrings. Maybe you need to strengthen your core after you do your hamstrings. I have videos up about for a hamstring stretch where you pull your leg up and then you raise your other leg up and down. That creates a lot of core stability. And I use it a lot with flyers for cheerleaders to train the pulling up into a full stretch at the same time as strengthening the down leg by strengthening the quads. At the same time, that's strengthening the core. They have to keep their back neutral and not let the back move as they're doing it. For my back pain patients, the same thing. That wouldn't be something I'd give you if you're coming in with acute pain, we want to get that to quiet down. That involves breathing, changing position, creating some nice easy motion. But then as you're moving into the next phase, you may do this hamstring stretch with a strap and work on stabilizing the core as well as loosening up the hamstrings and strengthening the quads at the same time. So you're covering all bases. Frequently people will ask, what do I need to, what stretches do I need to do? And it's a blend, right? We have to do all of it. We have to get our hips to move better. We have to create mobility first, and then we need the stability so that our muscles and joints can react quickly and provide that stability to allow us to move the way we need to. Once we have that, then we can build strength and really build the power and all the rest of it. So first move better, then move often, and move beyond. And the same thing goes as far as pain goes. Back pain can be chronic. Sometimes it comes and goes. I did a post recently. It was 2 years ago now. I deadlifted in the morning and I felt great. I did a quick warm up. I really didn't do my full warm up, and I deadlifted and I didn't do anything heavy. It wasn't a PR. It was actually a lighter weight than I had done in the past, but it was heavier than I had done recent. I felt no pain during. Later that day, I went to roll and move and my back went, I don't like this. And it was kind of like deep into my glute and my butt and a little at my lower back. Turned out my glute medius was overworking for my piriformis. I had to stretch my hip muscle, loosen that up, and then activate my piriformis. I think that was it. May have been the opposite. Might have been piriformis was tight and I needed to strengthen my glute med. Regardless, I needed to do more mobility work to get them even. I needed to work on my hip to get that to feel better, to get my back to feel better. And once I loosened that up and I was able to breathe and get into it and then create some better motion, that back pain went away. It's creating balance. It's creating better movement throughout. Whether you are cheering and, obviously try to get and stay symmetrical, but the nature of cheerleading is not symmetrical. But getting in and doing a good warm-up, making sure that the spine is moving well, the hips are moving well, we are not holding our breath as we are tumbling and stunting, and we are really creating solid stability work and building up the core strength and making sure that we're not just cranking through and doing our crunches, but we are actually training our posture to be where it needs to be, and then lifting heavy to get us strong and gradual progression to get stronger. That will help to prevent that pain. When we move well, it doesn't hurt. If you're older and you're a parent and you've had back pain for a long time, it's not going to get better quickly. It may take some time. So go in and see your therapist and take the time to learn what you need to do to move better. I am not a fan of surgery, and I always encourage my clients to avoid surgery if they can. Sometimes it's necessary. It depends on the injury. But with back pain, it hasn't really been shown to be effective. If somebody goes in and has a disc surgery, something always goes either above or below because it's correcting a symptom, but it's not correcting the problem. So learning how to move, learning what's missing in your movement will help you to avoid a surgery that is not going to fix the problem anyways, and it will help you to feel better and move better. It might be something you have to do long term. Wouldn't you rather do some exercises long term than try to then go in and get cut, have a scar now, and then you still have to do your exercises, and maybe you have to do more because you've had this scar and this injury. That's my plug. It's a soapbox. I'm very passionate about trying to keep people out of surgery and to keep people moving well because there's so much life to be lived. We don't need to be debilitated and not sitting on the beach or not enjoying and going for a walk because we have this back pain, right? We should be living our lives. We should be able to get in the car and go see our kids and just enjoy the process and not worry about the fact that our body's not moving right. On that note, if you are driving a lot to your cheerleaders practices, if you are flying to all over the world to competition, both you and your cheerleaders need to be doing some maintenance work when you get there to make sure that things don't just tighten up. There's a whole lot of exercises that you can do to prevent pain and to help you when, it's inevitable. You're sitting in the car for an hour or on a flight for 4 hours, things are going to tighten up. It's normal. But there are ways to manage it so it's not debilitating. And I hope you take those opportunities to do that. If you want to learn more, check out my injury prevention starter kit for cheer moms and cheer parents. I have a whole lot of exercises and PDFs to talk you through, when is it important to go get checked out? When is it something just to either do some physical therapy? When can they just stay home and create some gentle movement, as well as warm-ups and cool downs? And if you're a parent and you want some just basic exercises and kind of learn how to explore some motion that you can do while you're pumping gas or you're standing in line for the bathroom on a plane, check out my free 7-day hip and back pain relief guide. It's a 1-week challenge and there's a whole mess of exercises and program, stuff to read through. So check that out. That one's free. The injury prevention starter kit is only $27. It's yours for life and you can access it anytime. If you have any questions, please don't hesitate to reach out. I look forward to talking with you. And if there's a topic that you'd like me to discuss, please let me know. If you have not already, please subscribe to the podcast and share it with somebody so that they can get more information on how to keep their cheer athletes and you cheer parents feeling good, feeling better, reducing pain in the process. I hope you have a great week. Don't forget, when in doubt, breathe out. Take life one step at a time. You can do anything you put your mind to. You're responsible for your own vibes. Let's go get the day.